Scraping therapy can be used for treating lumbago caused by physical strain, pathogenic wind, cold and dampness, sprain or acute and chronic lumbago. Holographic meridian scraping therapy can bring obvious effect in treating lumbago caused by acute lumbar strain, muscular strain, or hyperosteoderogeny. Holographic scraping has the effect of diagnosis. When scraping the third metacarpal bone of the hand, appearance of pain and miliary cutaneous bleeding indicates pathologic change in the lumbar vertebra, and on this region indicates pathologic change in the sacral vertebrae. The appearance of pain and cutaneous bleeding on this region indicates pathologic change in lumbar muscles on the left, while on this region indicates the pathologic change on the right. This patient suffered from lumbar hyperosteoderogeny. In recent, she couldn't move rapidly. Movements of the waist were limited due to aggravated pain. Scrap the dorsum of the third metacarpal bone after smearing rubricator. After scraping, miliary cutaneous bleeding and pain appear in the middle and lower parts of the third metacarpal bone, which indicates serious pathologic change in the lumbar sacral portion. The scrapped regions on the head. Scrap the posterior one-third of vertex region of forehead using rigorous scraping. A few cutaneous bleedings may appear here and at one-third of vertex and occiput. Scrapped points for lumbago. Apply lubricator to the waist, then scrap from the upper to the lower. After several scrapings, miliary cutaneous bleeding begin to appear, and most dense bleeding on the midpoint of the waist and lumbosacral part suggests pathological vertebra. Scrap the points on the lumbar muscle in order to probe painful point, and scraping should be applied mainly at the painful point.
对于发现痛点的部位要重点刮拭。
The lumbar sacral part may be scrapped according to different signs shown on the dorsum of the hand. There are a few cutaneous bleedings but no node on the right lumbar sacral part, while subcutaneous node appeared on the left. The parts with node should be scrapped heavily, slowly and repeatedly. The node indicates serious stagnation in meridian with a long course and should be treated mainly. Dredging node can help treating lumbago.
疏通结节有利于治疗腰疼。
Scrap B40 point from the upper to the lower with tapping in order to expel harmful factors from deep meridian. During tapping, there are intervals for the patient to have a rest. And one hand supports the patient's knee joint, and the other applies force gradually to tap from the upper to the lower. After several tappings, deep cutaneous bleedings appeared. Purplish black dense bleeding indicates a serious stasis in meridian.
这里的沙比较集中。 暗青色的沙斑说明经脉阻滞严重。
The darker the color of cutaneous bleeding, and the longer its course, and the larger area of cutaneous bleeding, and the bigger its meridian stasis. Scrap B57 point. For lumbago caused by sprain with the corner of plate, press GV26 point suddenly and repeat it several times. Scrap SI3 point at exterior of the small finger and lumbar point on the ear. Scrap lumbar point and lumbar sacral vertebra point at the inside of the foot with applying force. Lubricator must be applied for a longer session. Daily scraping has the effect of treatment and health care. After scraping, the patient can walk, bend, and move freely without pain.